absorbed quicker. I was never able to find any evidence for that. I'm not sure it actually translates into a meaningful effect, but he recommends that, and he writes all the textbook chapters. But if you take it with food, you're going to interfere with the absorption of it. It's like a thyroid pill. You want to really take it on an empty stomach so you could get it to work. Sometimes it's not practical. Sometimes, you're running around and it is what it is. And so it's better to take it with meals than not take it. But ideally taking it on an empty stomach an hour before you eat, by itself without any other medications is the ideal way. But now you take a thyroid pill, which should be taken by itself on an empty stomach. Then you got to take Cinnamate, which should be taken by itself on an empty stomach. And you spend your whole day taking pills. I will tell you, with the thyroid pills, we do something where we tell our patients to put it on the bedside. And when you get up at 3, 4, 5 o'clock in the morning, take it at that time. The Cinnamate, some people in the advanced stages are taking it through the middle of the night, but most people are taking it when they get up in the morning. But in advanced Parkinson's disease, some people have to set an alarm clock, and they have to take it throughout the whole night, because otherwise when they wake up in the morning, they're so rigid that they just can't get out of bed. And so, but, so I don't think exercise is going to affect the absorption of the drug in a meaningful way. Exercise shunts blood away from the stomach, but not enough that it would affect the absorption of the drug. So if you took your Cinnamate and then went into exercise, it probably wouldn't have a meaningful effect. Our stomach is not as acid as we get older, tends not to affect our medications. When we worry about medications, or when it's more than a 10% effect. And a lot of the things, caffeine and such, has such a negligible effect. It's measurable, but not enough that you should be worried about it. If you were to take every pill properly, you'd have no time to do anything. Beta blockers work better with food. I mean, you could go crazy. And you should only do that if it's super, super important, like Cinnamate, like a thyroid pill, because otherwise you'll never enjoy life. You'll be taking all your pills. So the question was about the trials with the alpha-synuclein. So there's a lot of trials going on. I think it's a very exciting, and but we're probably 1 to 5 years away from any meaningful results. Parkinson's Parkinson's and Alzheimer's are two depressing diseases. Both of them we've spent hundreds of years studying, and we really have made no progress. And you think about what we do for Parkinson's, we give you dopamine. And whether we give it in Cinnamate, whether we give it in a dopamine agonist, whether we give you a drug to increase your dose of dopamine, it's all the same. There's nothing new, it's just a different mechanism. And ultimately, the cures for the disease are going to be treating the underlying mechanism, the loss of dopamine. When we try to mimic the body's function, we could never do it the way it is. Whether it's diabetes, we do a great job with insulin, but it's still never the same as your pancreas measuring your glucose every second versus us measuring it every 3 or 4 times a day. And so there are some, alpha-synuclein is an exciting area of research. Whether it's going to pan out, we're all optimistic. There's a couple other studies on different pathways trying to prevent the actual cell death that happens if you stain the dopamine. I'm sure when John Campbell gives his talk, he shows you slides of the substantia nigra, and you see that there's no black and there's a loss of dopamine. Well, why did that happen? If we could prevent that, well, then we prevent Parkinson's disease. All we're trying to do is give back the drug that's missing, the chemical that's missing. Yeah, the human body is very complicated. and if you really want to get depressed, look at the Alzheimer's research. we think we got it, and then the drugs don't work. And now we're saying, to think we got it, maybe we don't think we got it, maybe we don't know what we're talking about, maybe we don't understand it. And then I just read a trial done on Alzheimer's that was almost comical. It was a big trial, it was a Lilly drug, and it didn't pan out. And the editorial said, well, maybe the people didn't have Alzheimer's disease. And it's like, what was an Alzheimer's trial? You know, and it's just, it's frustrating, but I'll tell you that, you know, it's complicated. It's not from a lack of trying. It's not from a lack of funding. You know, the funding is there. It's just difficult trying to do these. It's the same reason why we give insulin as an injection. If you give insulin as a pill, the stomach breaks it up, and it's the same problem when you deal with amino acids. The stomach breaks it up, and that's the problem with, with treating Parkinson's disease. But ultimately, the way we're going to get there is through research, even though it's painstakingly slow. But the key is awareness, and the reason why PASFI has been such a wonderful organization is they're not trying to cure Parkinson's; they're trying to take care of you. They're being realistic. How can we make the best of a bad disease? And that's what they do. They support the caregivers. They support the people with Parkinson's disease. And if you never heard the history of how it was started, you should ask Ellen and Jackie to tell you about it. It's truly a remarkable organization because they're realists. They know that they hope for a cure, but they know they have to deal with it every day, even if there's not a cure. So. And I'm sorry? Right. Unfortunately, when we're all born, it is progressive and ultimately is fatal. There's an interesting study that recently came out that if you look at older people who realize that they're going to die age better. And I have one lady that I see, and she's 96 years old, and she has a million things wrong with her, and we just keep her going. And the last thing she always tells me when I see her is, now don't let me die. And it's just like, I'm trying my best. So, well, I thank you guys for your time. I'll take your questions over on the side.
Thank you, Dr. Garry. Wonderful presentation. So 3 quick housekeeping items. This is a survey to give us some feedback on these events and Dr. Garry's events. So if you could please fill one of these out before you leave. They're located either at the end, the last seat here, or at the 2 exits on both sides of each door. There's a survey. So thank you for that. I want to acknowledge Bill Hughes, who's our videographer. Bill, thank you so much, sir. Appreciate your assistance. And finally, the Parkinson's Association is a not-for-profit organization. We thrive on donations that we receive from the community, and we have a donation box at the exit. If you feel inclined to donate something, we would appreciate that. So thank you so much. And we have lots of exercise classes. Our exercise instructor, Marge, is in the back. Thank you, Marge, for attending, and we appreciate you attending today. Thank you so much.